quickly around the table. Have you got any news you wish to share or anything you wish to just check in? I just want to how are things going. So starting with you, Gayle.
Let me think. I don't think anything from last time. We did host our event on Friday in Bundaberg, which was really good. Went very well. We're very happy with how things proceeded, and looking forward to the next steps and stages of what's going to happen.
It might be great if you talk about that today, because I think Troy might be particularly interested in what that event was and what we're doing. So that just the Bundaberg site, Troy is in its early stages of development, and Gayle's, she's a bit like you. She's got the service, but not the house quite yet. Things to share there. What about you, Karen? Things?
Nothing much to report. It feels like the lull before the storm, depending on what happens. Yeah, but we haven't heard anything definite about anything. Yeah.
Okay, and Troy?
Not much activity-wise other than Gayle keeps on keeping on, but in light of some recent budget allocation, when I say allocation, requirement to lose a few mil off the bottom line of this health service, I think we're really fortunate that we've already been provided the funding to continue with our community connector for another year, so that's fantastic, and to expand it slightly as well.
Yeah, good timing, Troy. Slipped in before.
Yep, certainly did.
Okay, so just a reminder, I think you still need to book in. We're doing our bonus Ask Us Anything strategy call heading into late July. So if I think Troy, you and Carly need to find a time and a focus for that, what you particularly like to focus on. Gayle, you're booked in, aren't you? Yeah, and Karen and Margot are booked in as well. So all good there. And I mentioned we've got this, I've got a webinar next Wednesday for the Community Connected program before we launch a Done Together program in late July. So if you've got people, I'll be speaking of the Community Connector and some of the impact that it's been having in your site. If you've got anyone that you think should meet me or hear about the programs, just half an hour. Of course, we'll record it and I might share it with you guys too, so it's a resource for you as well. So I'll put it up on your Facebook. Don't forget to look at your Facebook. I'm putting things up there more regularly. So just jump in and see what's up there. And so in relation to something more recently, the customer relations management system and surveys. So now what we've decided to do is we're going to create a Google Docs survey or a Microsoft Forms survey that's linked into your CRM, and it'll allow you to take 3 month, 6 month and 12 month snapshots with your clients, and it will line up with your check-in. So I'm assuming that you'll do your check-in and have your chat, and then you'll ask them, be able to send a link and say, could you complete that survey, which if you've done that warming up, that's likely to get good results, but it will really help you with proving impact. So those things will be done in the next couple of months, and so they'll be ready to go. So a really slimline version. We've been looking at Western District Health Service, particularly around this, and how best to get that operational. And we think coming through you, there's a little bit of you asking and people feeling a bit difficult, but we'll try and make sure the wording has it that there's a bit of an arm's length between you, if you're the community connector, and the results. But you can also lay the ground with that when you're asking people. But we'll get all of that. But is there any problem with us using Forms or Google? I assume that people are either in a Microsoft world or a Google world. Is that? Yeah, I'm thinking, and because they're free resources, and so that allows you to use them. Some of those things like SurveyMonkey or other things are really, there's a lot of barriers to entry, and so I'm thinking of how to make it as streamlined and easy for you to use and get consolidated reports. So there'll be reports, we don't see them. unless you want to share them with us at some point. We might ask you about that intention to stay, which is the final question, which is what we're mostly, how much has this program influenced your intention to stay, if you are intending to stay? So the next part is, I just wanted to show you the second part of the marathon interview, and let's see if I can finally do this correctly. So I'm going to, and otherwise Samara's going to do this for me in the future. I'm looking for, so I just want to jump on and get YouTube. Hold on. Okay. And now let's have a look. Okay, and share sound. All right, and then jump into chat if you can't hear. So it's about 13 minutes long, this one. The Community Connector program in Marathon, Ontario. Sarah and Brett, I'll get you to introduce yourselves.
Sure, why don't I'll go first, Brett. So my name's Sarah. I'm a rural generalist family physician in the community of Marathon, and I've been here for 28 years now, and I'm part of the Community Connector Community Committee here in Marathon. Brett?
Yep, my name is Brett Redden. I've been in Marathon since 2006. I've been physician recruiter and retention coordinator since 2010, and I am also originally from Newfoundland and St. John's, and I'm actually here right now at my hometown. I'm proud to be here. Thanks for having me, and look forward to speaking with you tonight.
Okay, this interview is for us to check in. We haven't talked to the Marathon crew since about 2021, and since we launched the Establishing the Community Connector program and the revised Attract Connect Stay website, I was interested in checking in with them. I had sent them that program and asking how they were going and to keep us up to date with what's happening in the original Community Connector site, as we call it in Australia. To get started, perhaps I'll start with you, Sarah. We're interested in developments and impacts in Marathon. What key developments have occurred with your Community Connector program since our last interview in 2021?
Yeah, thanks for the question, Kath. And I would say that we have not grown the program locally, but I think coming out of COVID, I actually feel really pleased that we've been able to successfully sustain the program, including the commitments to funding that we have. And we have been able to continue to support learners and locums and have a stable physician group here. We also have been able to support Brett to some extent to be able to connect with other recruiters across Northern Ontario in particular, but also across Canada, to be able to support them in their efforts and understanding what a community connector or concierge kind of service can look like in their communities. From a local standpoint, though, I would say we've been pleased simply to be sustaining the services that we have as we emerge from the pandemic here.
Thank you, Sarah. And I'll perhaps ask you the second question and then we'll just jump to Brett. So in this group of questions, how has the Community Connector program continued to impact the residents of Marathon, Ontario? And have you received any feedback since we last spoke about those impacts from your community?
Yeah, I think because Brett has been in his role for some time and we have had a stable physician workforce and a fairly steady stream of locums and learners through the community, Brett's role in some ways has become a bit like oxygen. You don't notice that it's there until it's gone. And so I don't think that there's actually been a lot of community feedback around the role because it's been successful and because we have not had disruptions in clinical service locally. There has not been any physician crisis here. And so the community, I think, is generally pleased and in many ways, in some ways, I think a bit unaware of how successful it is because there has been no crisis here. I would say that Brett is very diligent about posting in social media when we've had locums or learners who have been here, sharing the activities that they've done and sharing their experiences with their consent, of course. And the feedback from community in those social media posts is always very positive. They're delighted to know that we have locums and learners, delighted to know that Brett's in the role that he has been in, but it has really been at that level of sort of social media celebration of good things.
Brett, I might get you to start with this question, and then it's off the script now. In comparison to other places in the north of Canada, how much better is Marathon doing than average? What's the picture in other places?
Yeah, we've been fortunate to maintain, obviously, to complement. I think it's always difficult to put an actual stamp on it, just because certain communities, I don't know all the complements, obviously, of all the actual groups within inside our region. Like, for instance, some are 2, some are 3, some are 5. And when you look around, we do have communities that have as many physicians. Neighboring one in Nipigon, about an hour and a half or an hour outside of Thunder Bay, they have 8 physicians there that come and go. And we have 7 right now. And I feel like there's always that fluctuation of up and down, obviously, with physician recruitment and retention. And in some communities, they only have 1. Some have gone from 3 to 1, some have gone from 2 to 4, down to 2. So there's always that little bit of fluctuation. So I think it's really hard to pinpoint whether we're doing, I would say, what I would say is we're probably the most stable. I think that's probably the best way to say it. As Sarah mentioned, we've never had really that crisis point. And that's what obviously we're all trying to avoid.
Well, you did, way back, you did have crisis points. That's what.
Yeah.
Yeah, originally, right? 2010, 2011 was obviously a touch and go. And then it grew from that I would say 2012 onward, it started to look a little prettier for sure.
So you're a stable workforce. You're pretty confident if you lose a physician that you're going to be able to replace them in the short, medium term. Yeah. Yeah.
Yeah, I would say in the average term, I mean, we tend to get it usually still in that year, still at 12 to 18 month average in Canada right now for when you first to recruit somebody. Obviously depends on the group. Sometimes it's instantaneous, right? We're very fortunate with having Sarah in the position she's in, with the access that we have for all the awesome residents and students that come through. And we have recruited obviously from that pool before and been successful. And we still have people here today because of that, that worked through NOSM. They were students, residents, and started with us right after graduation. And we'll continue to have that. That's a vision that Sarah had, I know, years and years ago before anyone ever really thought of it. And being able to have medical students. We used to only be able to, we weren't even having residents at certain points. We were mostly just having medical students, but obviously that's expanded. And now we're having PGY1s and PGY2s, and that allows us obviously to start them right upon graduation after PGY2. So if they don't obviously continue on with further education.
Right. And Sarah, just quickly, could you say what NOSM is and any comments on that question around workforce?
Yeah, absolutely. Yeah, thanks for that. So NOSM is the Northern Ontario School of Medicine University now. It originated in 2002, brought in its first class of undergrad learners in 2005. And so we'll be celebrating its 20th year next year. And so that has been probably the single most important physician workforce strategy for Northern Ontario. But despite NOSM's presence, what is very clear is actually that broadly across Northern Ontario, and again,
I'm assuming that's frozen for everyone.
really to help address physician workforce strategy, but what we've seen broadly is a decline in physician workforce, both in Northern Ontario and certainly across the province of Ontario. Ontario has roughly 14 million people, and the last data was that roughly 2.4 million people now are without a family physician in the province of Ontario, and that's forecasted to be 4.4 million by 2026. So as will be no surprise, I think, for your audience, when the human resource challenges increase in urban settings, there tends to be a magnification of those challenges in rural settings. And we have certainly seen that as we've emerged from the pandemic. We have communities now in Northern Ontario that have no physicians at all, and that is new. We have more communities that are dramatically under their designated complement. So the complement is the number of physician positions that the Ministry of Health designates for a community in order to be able to access things like recruitment incentives or retention incentives for those positions. And what I am hearing in my role as Associate Dean of Physician Workforce Strategy for Northern Ontario is that for the majority of communities in Northern Ontario, things have actually not been worse than they are now, including for some of our large rural settings. And so this is a time that I think the stability that we've been able to maintain in Marathon really is a marker of significant success as we see communities around us struggle even more than they were struggling pre-pandemic. And physician workforce challenges are chronic in many of our rural communities, and that is absolutely the case in Northern Ontario.
And very similar in Australia. Things are much worse because of those shortages are now appearing in urban all health workforce, but particularly across the GP workforce.
Right.
We are beginning to see communities as well who don't have a GP, as we've also got baby boomers retiring, and
Right.
it's not such an attractive position as it once was to take up. And so those smaller complements that you were talking about, Brett, are really struggling. If they lose one, they might get four to they lose their position.
Yeah.
So talking about expansion and adaptation now, what's it been like to see your community's health workforce strengthening an initiative become an evidence-based online program in Australia with now multiple established sites, because I keep these guys up to date, everyone, and influencing government programs like the New South Wales Welcoming Experience. Brett, I'm going to start with you on that one.
Yeah, so obviously it's humbling to see a small community such as Marathon mentioned and accepted as a successful recruitment model for communities within Australia. But just to hear our name anywhere outside of Marathon is always pleasing. Most people are still trying to figure out whether we're a community or promoting running, right? We're doing our best in terms of doing a geography lesson, but I think from my perspective, just as a recruiter, obviously, just to actually have our community out there and actually have an actual platform for it to be spread in terms of how the actual program is affecting not only our community, but hearing some stuff from your end as well and some of the interviews and stuff like that I've seen online. So it's obviously humbling. We're honored to be a part of it.
Right. And Sarah?
Yeah, I think it's super exciting. And one of the things that I found really valuable, Kath, is when I look at the work that you've done to articulate in ways that we have not, what the elements of the model are in terms of the attract, connect, stay, and the modules that you've formatted. I feel like what you have done is give language and structure to what for us began as a fairly intuitive kind of process. And I feel that it is brilliant that the model that you recognized as potentially quite powerful has been accepted in a way in Australia that I think, as an outsider looking into what's happening there, has seemed to have significant impact. And certainly it is my dream that we could convince a broader cross-section of communities in Canada to take this work that you have done and adopt it in a new way in the Canadian context, because we know that it can work. But the structure that you have provided for it, I think, makes it much easier for communities to adopt and adapt to their particular context in ways that can be both meaningful and impactful. So from my standpoint, it is really exciting to see this have wings in Australia.
All right, thank you. Can you hear me? Yeah. I'm sorry, I don't know what happened there. I played with something and shouldn't have. I'm getting smarter, but only so smart. Any questions on those interviews or that interview that I've been breaking up into bits? No? All right, so it's going to be a short meeting today, but what I'd like us to do is to continue to get to know each other. And to do that, I'm going to ask you to take a turn in talking about a significant event or something with your Community Connected program, and what you learned from those, or what are the key impacts. And Gayle, would it be all right if we talked about your event that you have just held and start with that? And so, because I just think it might be useful for everyone, and particularly to get it recorded. Over to you, Gayle.
Thank you. Yes, so I guess for us, because we're at that beginning stages of the Community Connector program, we really needed to establish a little bit of background for Bundaberg and where they're at and where they want to be in the future, and how this Community Connector program can potentially help fill that space. And quite coincidentally, at the start of the year, we were approached by the local neighbourhood centre here in Bundaberg to run a project, or to lead a project for them around filling three main things, which were long wait lists for allied health services in our region, service gaps, and workforce shortages. They were the three things. And that's what we set about doing. And for us, it was really important that we bring community together so that we could come up with a whole community approach to help solve these issues, or not necessarily solve the issues, but get community talking about the issues, get some momentum around, well, what's out there, what are we working on, and how can we do it better? And hopefully by the end of, or towards the end of the project, come up with some sort of collaborative model of practice, so that it wasn't people working independently to help solve this problem, but a more holistic approach. So we set about, over the past 6 months, doing a whole heap of stakeholder engagement. So we talked to lots of different people and organisations around this problem, what their thoughts were, what they were doing about it, what we could learn from that. And then we looked at like a national snapshot, and then we looked at a local snapshot and what that actually meant for Bundaberg. And what we did was we then hosted 2 community events. One was back in May and one was just this last Friday. The first event was around a community conversation, and we basically put out a calling question that asked our community, how could we leverage our collective expertise to, what was our question? How can we leverage our collective expertise and resources to create a more collaborative health system in Bundaberg? Sorry, I was just reading it off the board. And then we hosted another event on Friday, which was how can we establish a more collaborative health system in Bundaberg? So when you start asking questions like that, people naturally become curious around, well, what is this about? What do we need to pay attention to here? So our second event, which we held on Friday, was an extension of what we did in May. At that first event in May, what we realised was that the community, and particularly those key stakeholders in Bundaberg, don't really work together very collaboratively. What we found was that there's likely more, but what we found was there's 6 collaborative frameworks being used in Bundaberg, but all independently. None of them were really working together from an integrated approach. And so we wanted to highlight each of those models. So at this second event, we brought in 6 different speakers who highlighted the work that they were doing, and we linked that to a community development framework, essentially. So we had speakers coming in and talking about a project which we then linked to a healthy cities framework, or a collective care model, or a asset-based community development model. And really what we were doing was highlighting to everyone in the room that independently there's all this great work being done in Bundaberg, but no one really knows what each of us are doing. We're not working collectively. And so at that event, I was able to speak about the Community Connector program and what that looked like. And in particular, we asked all the speakers to talk about the collaboration and the partnerships that were imperative to their project or their organisation doing the thing that they were wanting to do. And so it was a really good introduction to the 40 odd people in the room to hear about the Community Connector program, what we've done so far and where we're at and what it looks like and what it's going to look like in the future, and highlighting PHN, who were a funding partner, a Trek Connect Stay as the research partner and framework, and then our first client, which is Impact Community Services and the partnership there, and Bay Kids as the driver. We were also able to highlight what we need help with in the future, and for us, it was really important to highlight we are looking for a management committee, and it was particularly important for those people in the room to hear that, because there were people in that room that we want on that management committee. So people from our health service, from community organisations, from businesses, allied health partners, all sorts of different people. And then also we had the council and people within members from the region hearing that it's not only a health project, but also in the future it will be a whole of region attraction retention strategy. What we then took that event to the next level, where we introduced a possible model of practice that's actually been running in Bundaberg for probably 3 or 4 years now. And it was developed by people within Bundaberg Community Services who work a lot within the child protection and domestic and family violence space. And they actually came up with a model of practice called the Bundaberg Working Together Commitment. And it's essentially a framework that they developed together to help them come up with a set of responsibilities, principles, foundations, and goals of how they can push past judgment, suspicion, and blame to allow for growth of curiosity and relationships and compassion in them building a working together relationship. And so we had people talking about that, and it really demonstrated to the people that were there that there's all this good stuff that we're doing and we can work better together, and here's a way that's been a group of people that have been doing this already in your town. We ended then on asking the question to the people in the audience, how do we establish a more collaborative health system? And as we expected, they came up with lots of really great ideas and how they could contribute to that, or what some enablers or barriers might be to the next stages of that. And it really, I guess, for us now in the next few weeks is about keeping that momentum happening, encouraging that participation, and continue to bring those people together to keep building that relationship of trust. And that's essentially that event. A lot more work to do within that project.
Can I ask a couple of questions and then we'll open it? Did you have the right people in the room this time?
Yeah, this time we had higher level people in the room. So that first community conversation was more on the ground workforce. This time we had sort of general managers, CEOs, that kind of level, like decision makers, which was really nice. But what we didn't have was, for me, the two most important groups of people at that level. There was other people in the room from those organisations, but not at that level, were our Waibea Health and Hospital Service and the IWC, which is another UCC, which is another Medicare emergency care, like the second biggest hospital service in Bundaberg, essentially. Those two people at that level weren't in the room. So for me, that's the next nut to crack, is building that relationship so we can navigate how do we get those people listening to these conversations and working at a more community level.
And how did you get the right people in the room? This is Troy. I'm just this question is for you.
Yeah, I think that we've been building this essentially for the last 6 months, but having those really pointed conversations with the right people and starting where we know, with the people that we know, and then asking them to do those introductions and asking them to to get the right people there and really leveraging on those existing relationships. And essentially, I think in all of the communication we've had, we've been targeting those people. And so all the language is at that level that they get and they understand and they know that it's worthwhile me attending this. So not necessarily trying to target anyone below that, because I believe that you can say the right messaging, the right key messaging to the right people is going to hit the mark. And if anyone else turns up, that's great. But if I want the general manager or the CEO level, I need to talk at that level. And my key messages need to be at that level. And if anyone else turns up, that's wonderful.
Yeah, opening it up, Troy, Aaron.
It sounds like you've got a start there. If you're getting some bums on seats, that's terrific. From our perspective, we're still struggling to get that level of engagement. I know that very recently our new chief executive has met with the chief at our local council, and again provided a spiel in her words now, as opposed to our former chief's words, and pretty much seemingly got the same response, which was a slight nodding of the head, acknowledging that, yep, might be good, not much else. Yes, we're still trying to plug away here, but we're just hoping that that brick wall that we're headbutting is starting to show a couple of cracks.
I think for us, we've been in the community for quite a long time, and we've been established and have quite a reputation of doing really good work, and not that anyone else is not doing that. So we've got that foundation there and that level of respect. And so for us to put a call out and for people to come, it doesn't seem that hard, although I keep being reminded that it's not that it's not hard. It is hard. It's just that we do it well. And I'm trying to understand that a little bit more so I can articulate it better than that. But I think when you build those relationships, it is those key relationships and having a really good understanding of the people and what's in it for them, being able to articulate that value proposition and that advantage is really important.
Yeah.
I'm also interested that you have gone broad rather than specifically focusing on the Community Connected program. And there might be something in this, Troy, for a broader conversation around collaboration and what was the question that you were looking at?
How do we establish a more collaborative health system in Bundaberg? Yeah.
And I'm just wondering, and we're talking about August, that you dive in deep on Community Connector, aren't we? Quite delayed, quite strategically delayed, because I've been talking to Gayle about when I might come in, and we keep putting it off. So it's a bit like this is all that. And I'm just wondering, Troy, if we need to lay that groundwork just more generally and see if that will open up things a bit.
Well, again, our chief has picked it up. So Rowena is clued up. So she comes from an extraordinarily collaborative management style and background. So there would be no surprise that any time that she does speak out in community, that is what it's about. Having said that, one of the other things, I guess, just diverting for a sec, is that there's a lot of talk here in Victoria about the amalgamation of health services to try to strip some costs out of the Victorian state public health budget. There's a lot of overt to that. However, at the same time, whilst Rowena certainly is cognizant of that floating in the background, that has not stopped her from still talking in terms of how we can have collaborations without necessarily the amalgamations, but to make sure that we are overlapping with our neighbouring health organisations to ensure that we're providing the best overall service to our collective communities.
And Gayle, just so despite the Troy is actually a public health service, almost in every other site, public health has been the most difficult to crack, and it almost needs its own unique strategy.
Yeah, and we've definitely picked that up as well. I feel like we're making good progress, but I think it's going to take a long time. I think that we're starting to make those really good relationships, and I am just, if I can see someone if there's an event on or there's a forum or something where I know those key people from Bundaberg Health and Hospital are there, I'm there. So I've just been invited to some domestic violence forum, and I know that the CEO of the hospital is on this forum, this management committee. So I know that I'm going to be there because I want to develop that relationship, and I know that's going to future-proof this project. I guess it's really seeking out those opportunities for every moment that you have to say this is who we are and this is what we do to the right people.
Yeah, and the right
what we're working on.
I think much broader than in many other organisations. So you really need to be talking to the director of nursing, the director of medicine, and the head of community health. So we know that it's quite different, Troy, don't we? That they hold the responsibility for workforce, and their nod that this is something that will help them. Certainly, if you've got overseas migration coming into that's where that might be a hook, because that is a lot of work for them. The site that's most successfully done public, and they had a believer at the community health level from the very beginning, is in Tari. Yeah, and they've ended up getting a large contract on overseas migration from public health. It's the first I've seen of it, but all other sites particularly struggle with that relationship. So nothing unique there, but yeah, they do. Ideally, we need to bring them in somehow. They're a major user of the service. If we can. Karen, have you got anything to say at this point? Okay.
Not really.
All right, Troy or Karen, do you have an example that you want to share?
What sort of example was it?
So this was about a community story where your community connected program is impacting. Yeah, not specifically about clients, but more about the structures and things that you're doing.
Well, I don't know whether it's but we've recently, talking about working with the hospitals, we were approached by one of the midwives and then subsequently the maternity unit, head of the maternity unit at Glen Innes Hospital, because they'd just reopened, but they had 3 midwives that were relocating, and they'd been, the 2 midwives that were existing Glen Innes people had been asking around, asking for accommodation and hadn't been able to find anything for them. And they contacted me, and through advertising on social media to the community and also through the contacts that I have with the real estate agents, we were able to successfully house all 3 of them, which was a real bonus because 3 out of, I think there's 6 or 7 in the team. So if those 3 hadn't been able to relocate, possibly the unit wouldn't have been able to reopen. Yeah, and so I guess that was just good that I think the community are very supportive, and I had lots and lots of offers from private rentals from people in the community. And in these cases, they all settled with private rentals rather than real estate agents. Yeah.
Any questions? Any feedback?
Not on that, but I guess from WHS perspective, we've recently had just a little bit of a win again in the accommodation space. We had a situation where we've got a board full of international recruits coming in, and we were really struggling, or my recruitment consultant was really struggling trying to piece together the jigsaw puzzle that would land these people and house them and provide them the time to then source their own accommodation once they've arrived. So Carly came in and sat with Sydney and went through things, and in a nice little nugget, we seem to have a few nuggets to drop for us, Kath, I have to say. A nice little nugget, we had our medical workforce unit. Our doctors are managed totally separately from the rest of our health population. But that manager came and said that she was relinquishing a lease on a property that she used to house locums and VMOs and that sort of business, and basically asked if we'd be interested in picking it up. So we followed that through. We acquired that. I think it was only a 2-bedroom place, but furnished. And having procured that for our use, we put that jigsaw puzzle together, and we were able to put a plan together to make sure all our known pending arrivals all had accommodation mapped out. So that was lovely, and that would not have happened without Carly's input and I.
Yeah, I'm thinking both for Karen and for Western District Health Service. Next week, the Community Connectors are working with my marketer on success stories or to write blogs. And I actually think this housing one in both cases is a really strong, because there's so much story in community around housing and how difficult that is, and that is the main barrier, to actually show the value add a community connector can find solutions help find solutions in the web of stuff that exists within a community. So leads really well to assets-based community development approaches. What are the strengths and opportunities already existing in a community that just need to be tapped into? And I think both of yours are really good examples of that going on. And in your case, Gayle, I would really write you're doing, just to record what you're doing would, I think, bring consciousness to it, but bringing your audience along with you would be a great one for your blog as well. And we're hoping to be able to promote those stories as well on ours around what success is looking like for you guys at your different stages. Well done. It's lovely to hear that, Troy, when all the things come together and that team coming together to find solutions. And don't forget, Gayle, that medical workforce situation is not unusual, that they sit in this fairly separate category, which may not make any sense to any of the rest of us, but there may be solutions for them, and something like a community connector, but nothing like that for the whole workforce. That's pretty common, isn't it, Troy, that we've seen? Yeah,
the doctors are split out. They're special.
Yeah.
Just ask them, and they're entitled to, just by the way.
Yeah. Karen, are you still there?
Yes, sorry, I am. I'm just following around
Have to be careful. That Karen actually is a doctor, so should you too.
Yeah, that's okay. I forgive you, Troy. We are special, though.
Well, I'm not seeking forgiveness. I'm stating fact.
But that's because they do it at university. We are special.
Yeah, it starts
I know it's cultural.
And it also it's in Canberra. We've just just had a paper accepted for the Attract Connect Stay team on it. It's more than a GP workforce problem, like basically to begin to, because it's also conceptualized as that sort of problem. If we just had more GPs in rural, that the whole problem would go away. And I don't need to tell any of you that it's way more complex than that. And we need way more than just more GPs. And we can't afford a system that's entirely based on GP, nor does it give us the best level of care. So it's our first arrow. It took a while to get it published, and we had to get it past the doctors who thought we were being a bit offensive. So thank you. We'll keep it short today. So I'll see you, Gayle and Karen, next week. I think Troy, you and Carly and I are having a strategy meeting, so we'll keep. But yeah, good work. I'll meet you at the end of July, on the 30th of July. I pushed it out 1 week just so it's the last Tuesday of the month. And also I will have been to the NT to talk to the emergency medicine rural doctors. So I'll send you nice photos. Pop them up. Me being warm and diving into pools, hopefully without crocodiles in them. So all right, take care, everyone. Thanks.
Thank you.
Thank you.